Hi there, I'm Anthony. Just a quick one. So most people assume that what separates a good massage therapist from an average one is technique. You know, what tools, what strokes they use, pressure control, skill with soft tissue. Those things do matter, but the thing that actually changes outcomes is what happens before any of that. It's assessment. It's looking, seeing, feeling. So assessment means understanding what is driving the problem before deciding how we treat it. Without that, treatment is educated guesswork. The work might feel good at the time, the symptom settles, then it comes back because the source was never actually found. We didn't assess and work it out. So just quickly, my name's Anthony McKergow. I'm a qualified remedial massage therapist. I work out of PCRMT at Hoppers Crossing out of the Platinum Fitness Gym here. Now, assessment-led treatments is pretty much the foundation of how I work. Not saying for all therapists, but it's how I work. And this is videos about why that distinction matters. So, what does assessment actually mean in practice? Before I do anything, I want to understand how your body's moving and more importantly, where it's not. Because that's going to tell me about some patterns. Not just where it hurts, what's overloaded, what's restricted, and what pattern is built up over that time. This gives me an idea of why it's not doing what it should be doing. Pain is often a symptom of compensation somewhere in the chain. One area is not moving well, so another area overloads to cover for it. This is usually the area that hurts. So treating the painful area provides temporary relief. The pattern driving it doesn't change. So the same thing loads again, the pattern comes back again, the pain comes back again. This is why people can receive treatment for the same problem for years without resolution. The symptomatic area is not the source is elsewhere. And this is what we try to find for you. It can be really tricky sometimes, but we always do try to find. When I say we, I mean me, because it's just me here. Now, assessment changes what gets treated. Once I understand what the pattern actually coming from, well, the work's directed towards that source. We might have to release a few things along the way to get to where we need to be. That's when treatment stops being management and starts producing change that carries over between sessions. And this is why a treatment plan is always the golden rule. It's not just a feeling of relief, but a clear understanding of what's contributing, what approach we're working on, how we're going to try and help this. Now, I say that because that clarity matters. Particularly for people who've been through multiple rounds of treatment, you've seen quite a few people without a satisfying explanation of why the same thing keeps coming back. What does an assessment-led session look like? It starts with a conversation. We sit down, we have a chat. How long has this been present? What makes it feel better or worse? What have you tried for this before? Try and get some facts behind it. Then, simple movement check. Can you move your shoulder this way or your leg that way? You know, try and get something there. It's not a formal clinical battery of you have to do this test and that test. It's just to get some ideas. From there, treatment is often chosen based on what shows up. The session's built around your body and the actual presentation or what's going on the day, rather than some clinical model. So it's not a preset routine that's applied the same way to everyone. It's tailored to you. Now, this approach suits people who've been managing something long-term without resolution. People who feel something's not quite right, but haven't been given a clear explanation of where it might be coming from. If the same problems come back more than once, assessment's probably what's been missing. I mean, if you just jump on the table and they start treating you straight away, there's no assessment there, so how do you know if the outcome is going to be what you're after? Now guys, I'm based in Hoppers Crossing at Motto Court, and I serve Point Cook, Werribee, Tarneit, Truganina, pretty much the western suburbs. If you want some assessment-led treatment, rather than just get on the table and get a rub, jump online, use the booking link, find yourself a time that suits you, and I look forward to seeing you then. Thanks.